Okay, I think we have a full house, so we're going to get started. Maybe we can find a couple more chairs. Really excited to welcome you today. I'm Joanna Cohen. I'm the director of the Institute for Global Tobacco Control here at the School of Public Health. And every month we have an Innovations in Tobacco Control lecture series. It's usually in this room because there aren't a lot of rooms where you can actually have like food in them. So it's one place we can provide food and a wonderful lecture. So it's my pleasure today to introduce our speaker, Dr. Julia Chen-Sankey. She's a postdoc fellow at the National Institute on Minority Health and Health Disparities at NIH. So she's actually an alumnus from here. She did her MPP, her Master's in Public Policy, here in 2012, and then went on to do her Ph.D. at the University of Maryland School of Public Health. And her interests are in social and behavioral sciences, and with a lot of interest in tobacco control and health disparities. And she's been doing tobacco control work for a long time. So it's wonderful to have her here. And she's been most recently interested in the issues around flavored e-cigarettes in particular. So that's what she's going to talk to us about, focused here on the US, but also talking about use in other countries. So I'm really delighted to have Julia here, and welcome.
Yeah. Great. Thanks, Dr. Cohen, for the introduction. Hi, good afternoon, everyone. I'm Julia Chen-Sankey. It's very glad to be back to Hopkins again after 7 years. This is the first time I came back to the campus. And then thanks for the invitation. The building's still the same, and then it's great to see some familiar faces in the audience. And I see Dr. Sharpstein there. I used to work at Maryland Department of Health with Dr. Hussain when you were the commissioner. So it's great to see you here. So my talk today is flavored e-cigarettes in the US and other countries, talking about evidence, policies, and challenges. So just a little disclaimer, this is my own opinion. This whole presentation is my own opinion. It doesn't represent the perspectives from National Institute of Health or HHS, Department of Health and Human Services, or the US government. So a little bit content today, an introduction to flavored e-cigarettes. I will start with that, and then transition to flavored e-cigarettes in the US with focus on use, adults, and regulations. And then I will move forward to flavored e-cigarettes in other countries, and I will give a little summary of those evidence, and then finish the presentation by introducing challenges and the future research directions in this field. So first of all, intro to flavored e-cigarettes. So many of you probably know already, flavored tobacco products in the U.S. is kind of consume a lot of the market in tobacco products market in the U.S. and also not just U.S. but also in other countries. So as you can see from this figure, flavored tobacco use among teenagers in the U.S. is really consume most of the tobacco use prevalence among this group. As you can see, hookah, e-cigarettes, and all the way to cigarettes, most of the teenagers who are using tobacco are actually using flavored tobacco that tastes differently than tobacco flavor, but mostly candy, dessert, and fruits flavor. And then in terms of flavored e-cigarette products, there are many, many types of flavors. We all know. As of 2017, more than 15,500 unique flavors were found for e-cigarettes in the US and other countries. And most of those flavors are very child-friendly flavors, such as fruits, candy, desserts, and sweets. And also those flavors always come in with names such as unicorn blood and zebra cake with very child-appealing names. And they also you can see those patterns in different colors, and that's very attractive to teenagers. And just the flavor names that comes with unicorn, there's more than 20 of them in the market as of 2016. And this paper published by Dr. Jeckler kind of tracked the cartoons of unicorn flavors of e-cigarettes in the US. And you can see those are very interestingly named flavors such as unicorn milk, unicorn cream, unicorn juice, and they all come in with very child-appealing cartoons. And types of flavored e-cigarettes. We all know e-cigarettes comes with different formats, different generations, different types. So the first generation of e-cigarettes is disposable e-cigarettes that usually come with a brand we all know from gas stations and convenience store, which is Blue. Blue comes with a set of flavors ranging from menthol to cherry crush. And then the second to third generation, we have tanks and mods that you can replace the batteries, and then you can replace e-juice in those e-cigarette products. And then you can purchase those little e-cigarette liquids from the market too, to kind of fill in the liquids that you want, and also mix the different liquids together to build your own flavors that according to your preference. And the latest generations of e-cigarettes that's very prevalent right now in the market and then consume most of the more than 80% of e-cigarette market is rechargeable e-cigarettes. When some of the biggest brands is Juul and Suring, as you can see. To the left is the Juul brands with it's also its pods, and then to the right is Suring drop and Suring Air that just look like a school supply. And then in 2018, some European researchers published this paper to investigate the flavor categories of e-cigarettes. And there are 13 main categories and 90 subcategories. As you can see, some of the biggest categories are fruits, and then followed by desserts, candies, alcohol, and other beverages and other sweets. And most of those flavors are actually very child appealing and teenager appealing flavors. As you can see on the brown is tobacco. So tobacco flavor is only a little bit in terms of the whole flavor categories. And then those tobacco flavors actually mimic the flavor of cigarettes. So as you can see, most of the flavored e-cigarettes actually taste very differently than cigarette products. So transition to flavored e-cigarettes in the US context. First, about use. So I want to kind of introduce the prevalence of e-cigarettes first in the US teenagers. So in 2018, about 5% and 21% of US middle and high school students are currently using e-cigarettes in the past 30 days. And then this prevalence was only 1% and 2% in 2011. So as you can see, across the 7-year period, the increase is huge. And just between 2017 and 2018, the increase of e-cigarette use prevalence was 48% among middle school students and 78% among high school students. And then this whole explosion of e-cigarette use coincided with the increase of prevalence of using Juul and other this kind of Juul-like e-cigarette products. And then according to some of the national data, most of the youth who are currently using e-cigarettes are using flavored e-cigarettes. So 81% of youth used a flavored e-cigarette the first time they tried e-cigarette products, and 85% of teenagers are currently using flavored e-cigarettes if they are current users. So as you can see, almost more than 80% of them are using flavored products. And then how do e-cigarettes become so popular among teenagers? A lot of people are asking, especially between the year of 2017 and 2018. I think the answers are threefolded. The flavors make it easy to hit, the devices make it easy to hide, and the nicotine makes it hard to quit. So as we all know, the flavors really introduced e-cigarettes, a lot of attractive flavors. The kids started to hook on this product because of the attractive flavors. And the devices we recently observed, such as Juul and the Suring, make it very easy for teens to hide it from their parents and teachers. And the nicotine in those products make it, for teenagers, very hard to quit those products because they are high nicotine level. So I want to play a little, if you guys can take 10 seconds to look at this picture to see what do you think are in those school supplies are actually e-cigarette products. Okay, time's up. How many do you think there are e-cigarette products in this picture? 4, 6? Any other numbers? 10? All of them? It can be. I find 4 that I'm 100% sure are e-cigarette products. The one on the top is definitely a Juul, and then the 2 in the middle are Suring drops. And then the one on the bottom, I think it's a new generation of blue products. But there could be all of them. You never know. The chapstick in the middle, the blue chapstick, can be an e-cigarette too, because e-cigarettes come with different formats now and different, even like looks like a toy or even like a chapstick or anything that you can imagine. So also, maybe some of you know already, 1 pot of Juul is equates to the nicotine level equates to one cigarette pack. So if a kid is juuling, like finish 1 pot a day, that means the kid is actually consuming the nicotine level of a pack of cigarettes. So you can see the high nicotine level and why so many teenagers right now are addicted to those new generations of e-cigarettes. And then later last year, the U.S. Surgeon General announced that teen e-cigarette use is an epidemic in the country, and then immediate actions needs to be taken to address the issue. And then especially after FDA announced several warning letters to Juul company to kind of remove their flavors from the market and change their social media marketing strategies. So what are our teens in the U.S. perceiving flavored e-cigarettes? Some studies shown that flavoring was reported as the most common reason for youth to use e-cigarettes. So more than 80% of them said that they use e-cigarettes because they come in flavors I like. So you can kind of see flavors are inviting this group to use e-cigarettes. And then a lot of teens are actually perceiving flavored e-cigarettes as less harmful than unflavored e-cigarettes. So the harm perceptions of flavored versus non-flavored is different. And also, the teenagers who perceive flavored e-cigarettes easier to use than unflavored e-cigarettes are more likely to use e-cigarettes. So if they think flavors are easier to use, make them easier to hit, then they were more likely to use e-cigarette products. So what are the health consequences of flavored e-cigarette use among our teenagers? So evidence has shown that flavored e-cigarette use among teenagers is associated with increased frequency and persistence of e-cigarette use. So if a teenager is using flavored e-cigarettes, they're more likely to sustain their e-cigarette and vaping habits, and they're more likely to use it for a longer period of time than those who are using unflavored e-cigarettes. It also increased abuse liability and the self-perceived e-cigarette addiction. So the likelihood of being addicted to e-cigarettes in the nicotine level and nicotine content is higher than those who use unflavored e-cigarettes. It also increased cigarette smoking susceptibility, which is defined as the willingness to smoke cigarettes in the future. So the teenagers who are using flavored e-cigarettes are more likely to become cigarette smoker down the road. Also, flavored e-cigarettes also cause toxic emissions from those inhaling those flavoring compounds. Evidence has shown that it's safe to orally consuming those flavors. However, inhaling those flavors might cause damage to lungs. So, what are teens currently vaping? We know the e-cigarette use vaping rates is very high, and there you can vape all different chemicals and substances. So what are they currently vaping? So the Monitoring the Future survey in 2017 asked the students what you thought in the e-cigarettes you're inhaling last time you vaped. And then you can see from this bar graph that close to 60 to 80% of teenagers actually just vaping, they reported just vaping flavoring. Varies, only about 10 to 30% of them said they're vaping nicotine, and only 10% of them said they're vaping marijuana. However, this is just self-report, so we don't really know what they're actually vaping, and a lot of teenagers actually don't know that their e-cigarettes actually contain nicotine level. But as you can see from this graph, that most of them admitted that or perceive that they're actually vaping flavoring, and then that's why basically they're vaping e-cigarettes. So what specific flavors are teens vaping? In the Population Assessment of Tobacco and Health Study Wave 2 Youth Survey, I find that between 2015 and 2016, the U.S. teenagers are vaping. As you can see, the blue bar is green. The green bar is the first-time e-cigarette flavor, and then the yellow bar is current e-cigarette flavor. For the first time and current time flavor, e-cigarette flavor, both the teenagers are, the most popular flavor is fruits, as you can see on the left of this graph, and then followed by candy, desserts, sweets, and then followed by menthol or mint flavor. And then you can see tobacco, and so all the other flavors are kind of similar kind of percentage and distribution. So fruits and candies and desserts are the most popular flavors among this group. And then for what's the story for adults? We just talked about the teenagers. And then for US adults, actually, they also like non-tobacco flavors, just like teenagers. As you can see from this data from 2014 to 2015, also national representative, the bars on the left is adults. More than half of them were using, this is the first time use, e-cigarettes. So more than half of them were using non-tobacco flavors. And then as you can see the graphs on the right, for young adults aged between 18 to 29, more than 70% of them were using flavored e-cigarettes, non-tobacco flavored e-cigarettes. And then for the current use among adults, as you can see, adults and the young adults also like non-tobacco flavored e-cigarettes when they're in terms of current use. More than 74%, more than 82% of adults, adults and young adults are using non-tobacco flavored. And then kind of comparing those two figures together, as you can see, a lot of more adults and young adults are transitioning from using tobacco to non-tobacco flavors over time, judging from the initial use and current use. And so what kind of specific flavors are adults using? So as you can see to the left, it's still fruits flavored, just like teenagers, especially among young adults. Almost 70% of young adults actually using fruits flavor, currently using, and almost half of them were using candy, desserts, and sweets. And the menthol is still the third most popular flavor among young adults and adults. So this pattern really mimicked the pattern of teenager vaping, which is kind of different than a lot of other people, a lot of researchers are saying adults probably will be less likely to use non-tobacco flavored products. So argument about flavored e-cigarettes really is difficult because a lot of people are saying, so we know flavored e-cigarettes is bad among teenagers, but what about among the adult smokers who are trying to using e-cigarettes to quit smoking? So actually, currently, until today, there is very limited evidence demonstrating the effect of using flavored e-cigarettes on cigarette smoking reduction and cessation. We have a mounting evidence showing the association or weak association or strong association, no association between using e-cigarettes and smoking cessation. However, there's a lack of research on what kind of roles flavors are playing in the cessation process. So some evidence I found kind of touched on this point, including that flavorings actually enhances the rewarding and reinforcing value of e-cigarettes among smokers. So cigarette smokers who use those e-cigarette flavors are more likely to use e-cigarettes more frequently in a larger amount and for a longer period of time because flavors give them those values. And also, the variety of e-cigarette flavors is important for a lot of smokers to quit smoking through continuing using e-cigarettes. In a study I did 2 years ago, find that a hypothetical flavored e-cigarette ban would discourage smokers to use e-cigarettes. So I was asking young adult smokers, if your city or locality has this flavored e-cigarette ban, would you still use e-cigarettes in the same way? And then most of the smokers said, no, I would just quit e-cigarettes. I won't use it for my smoking cessation anymore. And also, this study found that cigarette smokers, including menthol smokers, are not satisfied with menthol or mint flavor being the only e-cigarette flavor choice. So they really value a variety of e-cigarette flavors in order to help them with quitting cigarette smoking. So as you can see from those limited evidence that flavors actually play some important roles for young adult smokers or smokers actually to reduce or quit their cigarette smoking. But we definitely need more evidence, especially longitudinal evidence to demonstrate this point. So 2 years ago, I used a past study to look at whether using non-tobacco and non-menthol flavored e-cigarettes is associated with the higher odds of reducing and quitting smoking among young adult smokers aged between 18 to 34. And I find that actually the young adult smokers who use non-tobacco, non-menthol flavor, if they use one of those flavor, their odds of reducing and quitting smoking is about 2.5, adjusting for risk factors for cigarette smoking and the socio-demographic backgrounds. And if they're using multiple non-tobacco, non-menthol flavor e-cigarettes, their chance of reducing and quitting smoking is about 3.0. So as you can see from this study, for young adult smokers, using non-tobacco, non-menthol flavor might help them to have a chance of reducing quit their cigarette smoking behavior over 1 year period of time. And I further looked at the data to see why that's the case. And then the data shows that those who use multiple non-tobacco, non-menthol flavor e-cigarettes are actually using e-cigarettes more frequently and for a longer period of time than those who do not use those flavors or only using one flavor. And this group actually have more favorable e-cigarette use perceptions than the other two groups. So as you can see, maybe their quitting cigarettes outcome is can be explained by their more favorable perceptions towards e-cigarettes and their more frequent use of e-cigarette products. So that kind of concludes my my studies and other evidence about adults of using flavored e-cigarettes. And then a little bit information on US regulations on flavored e-cigarettes. So as you know, like in 2009, we restricted and banned flavored cigarettes from the country. And because there's evidence showing that banning flavored tobacco products would reduce tobacco use prevalence. And there was evidence showing that actually the banning flavored cigarettes reduced teenagers' cigarette smoking prevalence. However, flavored e-cigarettes are currently widely sold and marketed in the US. Under the FDA's warning letters, Juul Lab halted in-store sale flavored e-cigarettes around end of last year. However, they didn't stop the selling mint flavor. However, the whole sales in the store right now, online store of Juul websites are still continuing. So they're still selling those flavored tobacco products on their websites. And there's no countrywide restrictions on flavored e-cigarettes currently available or present. And many local jurisdictions have taken actions to prevent teen vaping through restricting flavored e-cigarette sales. So local flavored e-cigarette sales restrictions in the US is a very interesting field. As of October 2017, flavored e-cigarette sales restrictions in localities, I find that 121 US jurisdictions have implemented such restrictions across 5 states. And those jurisdictions range from towns and cities and counties in the country. And then just a snapshot of what kind of states those jurisdictions are. Most of them, 101 out of 121 are from Massachusetts, and then 11 from California, and the rest of them are Illinois, Minnesota, and Rhode Island. And this number is still increasing. Today, there's 200 jurisdictions already banned flavored e-cigarettes. And then I looked at all those policies. I looked at 3 specific provisions. So first I looked at whether the policy applied to the restriction to the entire jurisdiction. So most of them, as you can see, 117 out of 121 applied their policy to the entire jurisdiction instead of only ban certain area. Only 11 out of 121 restricted menthol flavors. So the rest of them actually leave menthol flavors legal in their market, in their jurisdiction. And only 16 of them restrict the sale in retail tobacco stores. So the rest of them, or most of them, only restricted in gas stations and convenience stores such as Walmart or Walgreens. So as you can see, although we have all those policies in place, a lot of them are still very lax policies and not strict enough to ban menthol flavors or banning those flavors in tobacco shops or vape shops. So teens still have a wide variety of access. Top of online store sales, they still have a wide variety of access to buy, purchase, and use those flavored e-cigarettes. And if I remember correctly, this whole 121 localities only cover about 2 to 3% of the US population. So most of the US, I would say almost all of the US populations are not covered by such policies. So because of the explosion of juice sales in the US and then all the teen vaping epidemic occurred last year, FDA proposed a policy framework that says flavored e-cigarettes would only be sold in adult-only in-person stores or in age-gated sections where only those over 18 years old are allowed. So basically, the flavored e-cigarettes, they proposed that flavored e-cigarettes will only be sold in tobacco shops or in vape shops, or if it's being sold in gas stations or pharmacies, it will be in an age-gated section. So it's not going to be at the tobacco walls where you pay your tobacco. You have to walk the consumers into a specific section to be able to purchase those flavored e-cigarettes. And online retailers with heightened practices for age verification. So they were also proposing to change the practice of online stores for selling flavored e-cigarettes. However, a recent study done by the Choose Initiative shown that even after Juul heightened their practices for age verification, there's still half of the teenagers that they tested can still purchase e-cigarettes online successfully and receive the e-cigarette products. So even we have that online retailers kind of a new policy in place, we still cannot stop teenagers from purchasing flavored e-cigarettes online. This is not even including eBay or other websites that do not follow any of those rules. And in March 2019, several months ago, FDA announced a draft compliance policy with the following plans. Some flavored e-cigarette products will no longer be sold at all. And then also other flavored e-cigarettes that continue to be sold will be sold only in a manner that prevents youth access. So that's the language that they put out to kind of potentially regulate flavored e-cigarettes in the country. I think the comment period for this draft policy was just closed recently. We'll see what FDA's final decision will be after assessing all the evidence from the researchers in other area and tobacco industry as well and the public. And also the FDA commissioner said that if from 2018 to 2019, if e-cigarette use epidemic is not reduced or if it's not being controlled between this, so basically last year and this year, if data shows that e-cigarette use among teenagers is still going up, then they will definitely take immediate actions in banning either flavored e-cigarettes or other more strict actions on e-cigarette regulations. So we'll see the latest trend of data coming out, what it will show. A lot of researchers says that the teen vaping rates will still go up from last year to this year. And I also want to point out that mint or menthol flavored e-cigarettes are exempt from all those proposed restrictions from FDA. I want to point out this is that because the data we just saw, the type of flavors used in adults, mint and menthol flavors are actually the third most popular flavors used by those groups. So exempting the menthol mint flavors can, still leave room for teenagers to use non-tobacco flavored e-cigarettes. And a lot of anecdotal evidence has shown that a lot of teenagers use menthol mint flavors as a base to mix with other flavors. So it's not just they're using mint flavor alone, but they're using a mix of mint and other flavors together. So if we're still leaving mint and menthol flavors legal, that may serve them as another approach to use other flavors in the future. So after introducing US about flavored e-cigarettes, I'm moving to the other countries in terms of use adults and regulations. So after reviewing reports and data from other countries, I noticed that the pattern and trend of flavored e-cigarette use is very similar. For British use, I like the flavors is the second most important reason for them to try and initiate e-cigarettes. I remember the first reason being out of curiosity. And then the most frequent used e-cigarette flavoring was also fruit flavors, just like US teenagers. And for Canadian teenagers, fruit flavors were the most popular among current users, the same, it's still fruit flavors. And they also consider flavored e-cigarettes less harmful than unflavored e-cigarettes. Actually, this kind of less harmful perception, contributed to 36% of youth reduced harm perception. That's just equivalent to health warnings. So as you can see, a lot of trends and perceptions are very similar between international kids from other countries and US. I mean, for adults also, for young adults, majority of them prefer using flavored e-cigarettes, with fruit flavors being the most popular flavor, followed by candy and desserts. And for Canadian young adults, most e-cigarette users use fruit flavors, just like young adults in the US, followed by candy flavors, which is also the same. And for European adults, the survey was done among 28 European Union countries, showed that the most popular flavor is also fruit flavors. So you can see the trend and pattern is very similar internationally of using flavored e-cigarettes. Maybe the e-cigarette use prevalence in general is different, but in terms of under that umbrella, the flavors are very similar in terms of its popularity. So I'm definitely not an expert on the regulations from other countries, but I find that many countries actually banned e-cigarettes in general, so including Brazil and Singapore. And I think several years ago, Dr. Kennedy has a study published on, in 2016, there were 25 countries already banned e-cigarettes, and I believe this number is still increasing over time. And then many countries, including UK, regulated e-cigarettes by its nicotine content instead of, or rather than flavors. So flavor is definitely not on the radar of all those countries in terms of regulating e-cigarettes. The only specific language I find regulating flavored e-cigarettes are from Canada. So Canada's latest updates on their Tobacco and Vaping Product Act shows that they said specifically in their language, they bans the promotion of flavored vaping products that are appealing to youth. And the specific language is, no person shall display on a vaping product or on its package an indication or illustration, including a brand element that could cause a person to believe that the product is flavored if there are reasonable grounds to believe that the indication or illustration could be appealing to young persons. So that's their original language in their policy document. To me, it's kind of like it's kind of iffy. How I think different people might interpret this language in a different way. But I think it's a very good start to at least kind of try to regulate or restrict the promotion of flavored e-cigarettes that might be appealing to teenagers. And this is the only language I find from only Canada has that specific language. If you know any other countries have any policies, national level policies on flavored e-cigarettes, please let me know as well. And interestingly, in 2017, the EU survey among 27,000 adults shows that, the survey asked adults, what do you think about a flavored e-cigarette ban? In 2017, as you can see, the answer is very split among adults. 40% of them are in favor of such ban, and only slightly lower, 37% were against such ban, and 20% said, I don't know. So that's the latest data that we have in terms of perceptions of such flavored e-cigarette ban. However, according to my understanding, Juul e-cigarette companies has entered the UK market last year. And there's recent news showing that the teenager vaping rates in the UK has picked up a little bit, has increased a little bit since 2018 to 2019. So we'll see after the shift of the market activities, we'll see if the European countries will be more favor in terms of banning flavored e-cigarettes. So after introducing the US and other countries, I want to conclude on the evidence that I just introduced. E-cigarette flavors, especially fruit, candy, and dessert flavors, can lead to teenagers' initiation of e-cigarette products, escalated and prolonged e-cigarette use, regular combustible tobacco use in the future, as well as nicotine addiction. Those are the strong evidence, and many, many papers and reports have shown those points. And then also fruit and candy flavor e-cigarettes are also very popular among adults, regardless of cigarette smoking status. So this is kind of against a lot of others saying that adults do not like those flavors, but actually national data show, yes, they do like those flavors. And even for cigarette smokers who are very familiar with tobacco flavors, they still like those sweet flavors. However, there's very limited evidence exists to show that non-tobacco, non-menthol flavored e-cigarettes are likely to facilitate smoking cessation. We do have some studies kind of point to that direction, but however, there's no longitudinal or conclusive evidence showing this association. And the international regulatory authorities, including country level and local jurisdictions, need to regulate flavor e-cigarettes, especially after balancing the public health benefits among both tobacco-naive young people and adult tobacco users. So we're seeing two sides here. One is flavors attract teenagers, hook teenagers to use e-cigarettes. However, we're also seeing another possibility is those flavors might be helpful for adult smokers to reduce or quit smoking. Lastly, I want to introduce a little bit about challenges and future research directions. So one of the challenges is we are lacking education and communication messages to reduce the pure flavor e-cigarettes among youth. So currently we have some, Stanford has this educational toolkit on e-cigarettes. However, it's mostly about harm of e-cigarettes. There's a lack of educational opportunities for parents and teenagers to talk about flavors specific among teenagers, especially how tobacco industry is using this strategy to target this group. And also intervention and therapies need to break the flavor addiction among young users. As you may know already, there is many increasing number of teenagers in this country being addicted to nicotine from using e-cigarettes. However, those intervention therapies currently in place are treating the nicotine alone. They're not treating the flavor addiction. A lot of teenagers continue to use e-cigarettes because of those flavors. So I think it's important that we can create such therapy or interventions to kind of break this flavor addiction. And also, we know little about whether e-cigarette flavors are helpful for switching and quitting among adult smokers. There's very limited evidence on that. If yes, there's an association, how is this association occurring, and which flavor in specific is really helping adult smokers to quit smoking? We don't really know. So this kind of evidence will really be helpful to help regulators make decisions and also help healthcare providers and doctors to make informed decisions when they're giving smoking cessation counseling to longtime smokers. And lastly, given all those potential policy strategies we have in mind to regulate flavor e-cigarettes, I was thinking, what are the potential best policy strategies to do so? So the Canadian approach, we have banning flavor e-cigarettes through promotion and advertising. But actually, I was just looking for manuscripts on evaluating this policy, since this policy is really new, so there's no evidence actually showing it's effective or if there's unintended consequences or anything. So that's a potential strategy. And we can also kind of regulate the flavor descriptors on the packaging of flavor e-cigarettes, such as no descriptors as cherry or watermelon. That's another potential strategy. We can also, in a very complicated way, I guess, regulate the ingredients of the flavor chemicals in the e-cigarettes. When going through the approval process under FDA can look at the ingredients of the e-cigarette flavorings and make decisions. Maybe this flavorants cannot be sold in the US. That's also a potential strategy. Also, FDA's several new policy proposals banned use access to flavor e-cigarettes and e-cigarettes in general. So that could be another way for countries to kind of ban the access to flavor e-cigarettes among teenagers. Also, we all see menthol and mint flavors are the third most popular flavors that used in adults. However, the FDA and maybe some other countries are leaving this flavor out in terms of regulations. So really thinking whether we should still restrict menthol and mint flavors is very important in making such decision. Also, we can take the approach of Brazil and Singapore and other countries to have a complete e-cigarette ban, which means that we are not selling or allowing e-cigarette use or sales in the country at all. However, that might jeopardize or harm the chance for adult smokers who want to quit smoking. And also, I propose that there should be a matrix in place, especially for local jurisdictions, because every locality's situation is different, to look at how many adult smokers they have in their jurisdictions and how many youth population are in their jurisdiction and kind of balance between those two populations to make the final decision on flavored e-cigarette sales restrictions. Because given the evidence of adult smokers can potentially benefit from using this product, and youth population can have a lot of harm from this using this product, we need to have a balanced policy in that perspective. So those are some of the potential approach I think will be useful for moving forward for national level policy and local policies. And then that concludes all my presentation for today. And then I welcome any questions here. And then if you have any further questions, please email me for another time. Thank you.
Thanks so much, Julia. That's a real comprehensive presentation on flavors. And it's still very young evidence base on what we have. It's a lot of descriptive and self-report, cross-sectional data, but it was great to see what the evidence that we do have. I think the key, the key policy issue around flavors in e-cigarettes is we have to balance, we don't want flavors to get kids to start using the products, but if they're helping adult smokers quit regular cigarettes, you don't want to maybe limit that potential, which is what you've been talking about. The challenge is because the evidence is so limited so far that we don't really understand the true role of flavors for adults in quitting. And I think some of the research that needs to be done, if we're giving adult smokers the right amount of nicotine, because so far the e-cigarettes, a lot of the early generation e-cigarettes haven't been able to do that, haven't been great nicotine delivery devices. So if we can give adults the right level of nicotine that they need and want, their brains want, do they really also need flavors? And I think we haven't really done those studies to see. But these, again, there's a lot of research that's needed, and I really appreciate you sort of telling us what we know at this point in time. So questions, and we are recording this, so maybe you can start, and I'll get another microphone going.
Thanks so much, Julia. That was a really comprehensive overview of flavors, and I wanted to pick up on one of your last challenges in future research around metrics. Mm-hmm. You shared prevalence use from a whole suite of different surveillance systems.
Right.
I'm really curious on your thoughts about that proportion of users that say they're not using a flavored product. I was trying to track it between sort of 6 and 18 or 19% of users, depending on the
unflavored e-cigarettes, right?
There was a proportion that were reporting unflavored.
Right.
So are we asking the wrong questions? Or because I've gone in vape shops and I don't see any products that are not flavored.
Right.
Do you think, are people using a tobacco flavored and saying it's unflavored because they think it's like,
that
or
could be
what
a
do you
reason.
think?
Yeah, that could be one of the reasons that they're reporting it's unflavored. Or they actually don't know what flavors are vaping, so they just report, I don't know, like unflavored maybe. Or there's actually evidence showing that some adult smokers who are regular vapors will pick those intentionally vape unflavored e-cigarettes when they're between two different flavors. So it's kind of like a transition for them to
like a sorbet.
be able to taste other flavors. So, but those are for really regular e-cigarette like pros who use it like daily. So it actually exists unflavored.
But it's got to be a small proportion. Like even like 5% seems high to me. So I
agree.
It's
probably they were just using tobacco flavor, so they think it's not unflavored.
Yeah,
maybe for adult smokers because they're adjusted to cigarette flavors, right? And so tobacco flavors to them is unflavored, probably.
Maybe. Yeah, nicotine on its own is just so aversive, right? It's so bitter. It's hard to
Right.
imagine having that.
Yeah. Thanks for the question.
Hi. Thank you for your excellent presentation. I have a follow-up question on the smoking cessation data you showed. So in terms of like the study you did and your choice of outcome, right? You combined cessation with reduction.
Reduction.
And we know that reduction is potentially a problematic outcome because, dual users don't necessarily reduce the exposure to toxicants that they're getting.
Right.
And so I was curious if you know if those findings hold up if you're just looking at cessation instead of cessation plus reduction.
Yeah, that's a good question. I didn't separate those two behavior outcomes. So part of the reason is cessation is very low, but then reduction is kind of much higher than cessation. So that's why I combine them, because if I just look at cessation, the data is not going to be, the number of participants is not going to be high enough for me to have any conclusion. So that's why I kind of, and this is kind of the first study to look at that entire behavioral outcome. So that's why I grouped them together. And it's just a 1 year period. So even I separate them, it still cannot tell anything, because, a lot of smokers relapse in the future for cigarette smoking. So even I conclude it helps when them for their stop smoking. However, we never know if they're going to come back to use cigarettes again. But yeah, so I think future studies should definitely just looking at cessation itself and see if flavored e-cigarettes actually help them.
Yeah, I think that's what we need in order to make draw conclusions. Thank you.
Yeah, thanks.
Other questions? Oh, go ahead.
Hi, thanks again for your amazing talk. I was wondering when I'm a pediatrician, and when we speak to kids about what makes e-cigarettes so appealing,
great. Not a lot of doctors are doing that, so thank you.
they pull up advertisements, like they're not overt advertisements. Mm-hmm. They're memes made on Instagram with SpongeBob, and they're very subtle advertising techniques.
Yeah.
Like, are you going to drool today? And is there any legislation for? Are we looking at that? Are we looking at how social media can promote subtly these kinds of products, and are we regulating that?
That's a good question. There's evidence showing that Juul company and other e-cigarette companies are paying those social media influencers in posting those whatever posts they're having on social media to attract young people. Of course, they're not going to admit it, but there's documents showing that. And I remember last year, after FDA gave Juul Lab a warning letter, they removed all their official social media accounts, including Facebook and Instagram. So that could be a potential strategy that government can take on, issuing warning letters or giving them warnings like, you're doing this wrong, blah, 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 that kind of thing. I don't see any formal regulations or policies in place in regulating social media in terms of tobacco promotion. Because right now we can do it all in a subtle way, right? Social media influencers, you don't have to use your official account to promote those products. So it will be really hard to regulate in terms of that. But I think there's a regulation in place. I don't know which agency had a regulation, is that if a company is paying social media influencers on promoting certain products, it has to be noted in that posts. So I'm pretty sure a lot of the social media, the influencers are not doing that. But in moving forward, that could be a potential regulation that we can have in place to kind of reveal their identity, right? We're actually promoting this, so the teenagers will have more a chance to make informed decisions in what they're looking at. Yeah. So hopefully that will be a strategy down the road.
Hi, how are you? Thank you so much for your talk. I have two questions. So the first one was, you talked about the FDA's proposition of FDA's proposition of, I guess, how to regulate this stuff.
Right.
Why are the mint and methanol flavors exempt? What makes those flavors special than like creme brulee or
That's
something
a really
like that?
good question. According to my knowledge, maybe Dr. Cohen can also add to that, is because of the traditional cigarettes. When in 2009, under Obama's Tobacco Act, they banned all the flavored cigarette flavors, right? But then they kind of exempt menthol mint. Because I think it's a compromise between the government and the tobacco industry. Okay, you're banning all those. Let me kind of keep one flavor, right? So right now, in considering all other tobacco flavors, that's one of the consideration that keeping menthol and mint flavors legal. Is that like a general response? Yeah, but then we're also seeing the prevalence is so high among young people in terms of menthol mint. I know the Juul's mint flavors is actually their most popular flavor. So of course, leaving that legal can be problematic. Yeah.
And then my second question is, I was reading an article and it said how Juul representatives were going into middle schools and kind of marketing their product to like middle schoolers, like from starting at age 12. I was just wondering, how is that like allowed? Why is the federal government not doing anything about that? Because I mean, that's like 12-year-olds, and I thought you have to be 18 in order to smoke.
Right.
Like
So now everybody knows, right, Juul is bad and they're trying to lure teenagers. But back then, like 3-4 years ago, it was just a new product and they were doing a lot of things that people were not even aware of this brand. And I believe that what you said is the case in California, where those people were actually using a name of mental health counselors or mental health educational representatives or whatever, giving a free workshop to teenagers, and the teachers are not staying in the classroom because it's a mental health educational workshop, so you're not supposed to be in there like listening to your kids' concerns and stuff. That's why they get away from it. And then they also were using Juul in front of them, demonstrate how to use this and telling the kids that there's no harm from using this product at all. So, but now everybody knows, right? I think a lot of schools are educated enough to not let that happen. And then when you talk about this, actually Juul has been running summer camps in Baltimore for several years, collecting data from youth, mainly minority youth, to see their perceptions of tobacco products, what they would like to do, so to inform their marketing strategies. So that's another thing they were doing for several years to collect data from teenagers.
Federal government doing anything?
Now
about
they're
that?
actually now they know what they're doing. Now they're actually Juul is like on the radar. Of course, like everybody's watching it, right? But the thing is, just recently, from last year, there's a lot of Juul counterfeits and knockoffs available in the market. So even the teenagers are not having access to those official, real Juul products. They can still go to malls or go to those other places to purchase those knockoffs and counterfeits, which is more dangerous because they're not regulated at all. You never know how much nicotine is in those products, and they comes with thousands of flavors. Juul currently only has 5 or 6 flavors, but those knockoffs has so many other flavors. So that's another potential. So like in terms of regulation, they really need to regulate everything, not just one brand.
And I'll just point out, like on Julia's slides, when she talked about US regulations, there's a framework, there are plans, there are proposals. This isn't like official regulations yet. There's public comment period. So they're talking, but please, they haven't acted. They've made threats, but the federal government has not acted. They're proposing things. They're trying to get the companies to voluntarily take action from their threats, but there's nothing required yet. So, and it was clear on your slides: plans, framework, proposals.
Right.
Yeah.
That's a good point.
One last question, and then Julia will be here for a couple minutes. Any? One behind you. Oh, one, and sorry, behind me. Oh, that's behind. Okay.
Thank you. Okay, I had 2 questions, but now I'm trying to pick one. I guess I'll do the second one. Like, if we banned e-cigarettes, like, what would be like a way to get the e-cigarettes to those who actually want to use it as for smoking cessation? Would it be in the form of like prescriptions, or like what do you see like with the future? Like if we were to ban them?
Right. So one approach can be, if we are regulating e-cigarettes in that way, one approach can be and grouping it completely under smoking cessation therapies, and just like nicotine patch and nicotine gums, we can, kind of transition. It's not tobacco product anymore, but a nicotine replacement therapy or cessation therapy. We can do that if the government wants to take action. However, there's still very limited evidence showing it's effective. So before we have conclusive longitudinal clinical trials showing e-cigarettes are actually effective, then I don't think the government's going to take any action. But actually, UK government is very active in using, they're kind of advocating using e-cigarettes for smokers to quit smoking. So they're taking a very different approach than the US. I don't know, maybe they have more evidence there, or the regulation is different, but yeah. Thanks.
Well, just from from Dr. Sharfstein's class, the values are different in the UK, and they have a long history of harm reduction when it comes to smoking. So e-cigarettes fit into that approach of anything is better than smoking cigarettes. So let's make anything else available. So that's been around for a long time. I'll just make, I think that was a really important question. So right now, e-cigarettes are regulated as tobacco products. But of course, when they first came on the market, the idea is, oh, these are going to help smokers quit. We should regulate them like pharmaceutical products, like nicotine replacement therapy, right? So the FDA started that process. We're going to regulate them like other nicotine, cessation products. And an e-cigarette company sued and said, we don't want to be regulated like a cessation product. We want to be regulated like a tobacco product. Of course, there are very few regulations on tobacco products. And the Center for Tobacco Products, which regulates tobacco products, was very new, didn't have many successes around regulation of anything. So it's very interesting that even the e-cigarette companies knew at that time that they'd be much better off regulated as a tobacco product with very few regulations in practice. So that's just something that happened. So anyway, please join me in thanking Julia for a great overview of e-cigarettes and flavors. And we'll be back next month, so look out on your list of, Hopkins is a great place. There are talks all the time. So look out for us at the Institute for Global Tobacco Control. And Julia might have a couple minutes if anyone has any additional questions. So thank you.